Greetings, greetings, greetings. My name is Tanya Abreu, and I am the very proud Chief Executive Officer for Power Up Nursing and sometimes podcast host. I love hosting what I consider the healthcare transformational guests, those that do things radically different and get radically different results, meaning quick, rapid, and measurable success. My guest today is one of those people that appears to be very conservative and mild mannered. But after about a half an hour of conversation with him, you know that this guy has taken companies to billion-dollar valuations in healthcare and beyond. This man has worked for the US government to take vision into practical experiences that also become solvency success. I am very excited to introduce a healthcare executive, a organizational transformation visionary, and what I call one of the best patient experience thought leaders that I have ever met. And I'm going to bring up Chris Hamrick to our podcast. Welcome, 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 Chris.
Well, thank you. And it's very kind of you to offer that introduction. I appreciate it.
No, of course. And, I met you through the former board chair and CEO of one of my favorite life-saving organizations in the world, which is the Cancer Treatment Centers of America, where you headed up patient experience there, yes?
I was a brand and patient experience executive. So it's unique in healthcare to see patient experience coming from the brand side. It usually comes from a quality perspective or operations, but at Cancer Treatment Centers, it came from the brand side. Mm-hmm. And the reason for that is patients were the center of everything we did. That was our commitment. That was our promise. We really lived a promise made, promise kept scenario, which I've carried with me ever since. And I think that's one of the most important parts about when we talk about patient experience. It's really it's really about meeting patients in a way they want to be cared for. It's not about optimizing processes. It's not about HCAP scores. These are all important things to do in healthcare, but there's more to it than that.
I want to stop you for a second because that promise made, promise kept is something people throw around lightly, but you don't, no. Right? And as a patient, a brief patient at the Cancer Treatment Centers of America, while you were actually there, that was one of the first things I noticed. If somebody, a doctor, a nutritionist, a tech, told me they would do something, they did it. Yeah. And if they were going to be a little bit late, they sent me a text, right? And that was not in a time where it was flip phone texts, but they always stayed in touch. And I really felt that the promise that this institution made to do everything for my cancer journey, no matter how it ended, that I felt empowered, in control, they did. And thankfully, it ended very well, right? But I had the sense that, oh my gosh, even if it doesn't end well, I'm so glad I'm here because I feel empowered. I feel like a beautiful human being, and I feel that people listen. That patient experience has me sending every late stage and recently diagnosed cancer patients to CTCA. So talk to me about how you go from this promise made, promise kept byline into actualizing patient experience.
Well, so there's a couple of really important parts to think about. A promise made is and promise kept is about trust, right? And in our world, trust is a premium. Companies that are trusted, companies that are purpose-driven outperform their competitors by 3x, and often it's a significant difference. And the reason for that is that the customer, whether it's a patient or in other industries, they feel in some way an emotional connection, as you just described. They feel connected, they feel empowered, they feel safe, whatever it is that's important to them. Now, healthcare is a little different because we want to, use these business terms like, drive growth, right? Well, growth in healthcare isn't always drivable. It has to be created through a sense of attraction. And you don't get there unless you keep a promise, because people won't share their stories if the promise wasn't kept. Cancer treatment centers, it's now part of City of Hope. Another amazing patient experience organization, it was really at the center of everything we did. Literally, we had a mantra that said, you were at the center of our hopes, minds, and actions every day. It was taking the action beyond the transaction. That's where the experience lives. We'll start with people. People don't ever want to be sick. They don't want to go to the doctor. They don't want medicine. And in cancer world, you don't want surgery, and you certainly don't want to be burned by radiation, right? So there's nothing that someone wants in that scenario. What they need is a sense of return to normalcy. I want my life back. I want to be able to, see in a cancer diagnosis, see my children grow, graduate, walk my daughter down the aisle. All these life moments are what people value. And if we commit to helping you get there, commit is bigger than a promise. Mm-hmm. But if we commit to you that we're going to help you get there, and we communicate and treat you in a way that you want to be treated, you're going to be more compliant. Mm-hmm. You're going to be on time. You're going to do all these things that is otherwise forced in healthcare. It's going to happen naturally from the patient, so that the doctor and the nurse, which we'll talk about today, they're the star of the show.
Yeah. And I did put this up listening to you, right? That patient empowerment is about, gaining trust and gaining traction. That means, I remember reading, when there's infidelity in a marriage, you need to prove trust every single day, probably for the rest of your life, right? Mm-hmm. So patient empowerment is about creating trust in all aspects of care. I love that definition. And as you were talking, we're talking about nurses with Power Up Nursing. And we know that not only is there a direct correlation, but the reality is nurses who are empowered and satisfied and healthy create patients who are empowered, satisfied with great outcomes. Mm-hmm. So talk to me. If we're saying patient empowerment is about trust and traction, what about nurses? What's your thinking process around that?
Well, so my work at cancer treatment centers was really about understanding what you just described, the synergy between the patient experience and the clinician's experience, whether it's a doctor or nurse or, allied professional, et cetera. Because it's about the relationship. It's about the nurse being able to be the nurse he or she always wanted to be, about the doctor who wants to be the doctor he or she wants to be. These are very highly trained professionals that don't go to school to be, driving P&Ls necessarily. If they did, they would have gone to business school. But once they get through their academics and all of their clinical and everything else and all their training, now they're being told, oh, you have to think about, becoming a Six Sigma black belt. Again, nothing wrong with that.
Right.
Nothing wrong with that. I mean, it's great to learn new things. We always want to learn new things, but you didn't become a nurse to go learn Six Sigma. You went because you wanted to care for people. Mm-hmm. And so the question becomes, how do we let nurses be the professionals they've always wanted to be, they've always dreamed of? Getting back to that sort of passion that they had when they first went to undergraduate and were deciding about becoming a nurse. Yeah. And to do that, we have to understand that what is piled on in the process of caring for patients isn't always necessary, right?
It's peeling back.
Peeling it back. Yeah. Mm-hmm. Peeling it back and getting it to a point where an empowered nurse is one that is able to focus. An empowered nurse is one who has time to think. An empowered nurse is one who can take the time to listen, right? And care for someone, because healthcare isn't about putting, administering a treatment. It's about educating someone. It's about listening to someone, and it's about meeting them where they are and what their needs are, because you could have the same diagnosis and your condition could be very, very similar, but your way of approaching it as a patient is going to be different based on what you've done before in your life.
Right.
So
And
the question,
and what
that's
you
right. You don't know. So the nurse has to be this great translator of medical information and knowledge for someone who's going to ask a question she may never heard before, or be feeling a certain way.
And she has to feel like she's supported to be able to stand back, listen, and give an answer that benefits the patient.
Right. And so we have a lot. Healthcare is an industry filled with good intention. Everything that happens in a hospital, in a clinic, is done because we're trying to do the best we can. There's nothing, I don't say the things and think the way I think out of criticism. It's just over time, we've built a healthcare system that is distant from the patient and still is distant from the patient, and is distant and puts a distance between the patient and the nurse in this context of power up nursing. And the nurses are historically the ones who are the star of the show. I mean, think of an experience.
Powerful. I'm going to stop you for a minute, Chris.
Yeah.
Listen, nurses, this is really something that is a reflection moment. If we say that the current healthcare infrastructure was created, and maybe not originally created, but is sustained to distance the patient from the nurse, that just hit home. How many times have I watched patients disintegrate in front of me because there was no listening? There was a huge distance, a huge divide, and not just between patients and nurses, but between patients and doctors. And it seemed deliberately put there.
Yeah, I mean, deliberate but not nefarious, right?
Yeah, exactly. That's nice.
I don't think anybody was trying to create a problem. I think they said, let's try this. And what happens is, like a lot of things in life, is we try new things, but we don't take away the old things, right? We have things that are piled on one another, or when something doesn't work as well as we do, we sort of try to make it work, but it still isn't optimal. And maybe the whole thing needs to just be rethought. And that's where it gets
I've told this story before, Chris, and I think I've told it on a recent podcast. So I'm sorry if you've heard it before. Right. But I have a very good friend who's a chief nursing executive that said, look, nurse burnout was at not even an all-time high during COVID, but it was honestly suicidal risk. It was just absolutely untenable. But she also says that nurse burnout is expected from the time you're a nursing student and has been for dozens and dozens of years. What made the difference is what we're talking about right now, that during COVID, a nurse had to stand back even further. She had to not only physically, emotionally, but also clinically distance herself from her patient to follow guidelines that she believed may not have been helpful to the patient. And so what you had is a bunch of providers, including doctors, I'm sure, that walked around saying, I don't think these many people need to be dying. But then what do you do with that? If you right, that you're in war. It's a war zone. Everything is created to mimic, actually, during COVID, a war, mass unit. Having said that, you just have to swallow that. You just have to do what you're told. That's very, very, very detrimental to a sense of well-being and empowerment. It's the antithesis.
Yeah, and even before COVID, I mean, and you and I have talked about this before, we've been studying, nurse burnout for decades. We've been studying, the nursing shortage and the nurse educator shortage and all these things that have been on there. And I think if we were to look at two lines that show any growth in nurse burnout or nurse retention or anything like that, there's probably a correlation between the complexity of how care is delivered or some of these programs that are put in place. I mean, I was at a hospital several years ago, pre-COVID, and I noticed they had a decibel meter over the nursing station because they wanted to make sure the noise level didn't get too high or nurses weren't loud at night or whatever it was. And I thought about, these are professional and people and adults that don't need to have red, yellow, green going on at a nursing station to tell them they're being too loud. And, when I delved a little further, I asked about how they came up with that solution. And they said, well, they got feedback from HCAPs that it was loud at night and people couldn't sleep. Okay. But the patient researcher in me goes in and says, let's talk to the patients and find out why they couldn't sleep. Let's find out if it was a noisy bucket from a janitor going down the hall, or maybe they couldn't sleep as deeply because of their illness and they were easily awakened, right? There are variables about other than just taking the superficial, oh, it was too loud, I couldn't sleep.
Had to be the nurses.
and we're going, and we think it's, that we're going to tell the nurses they need to be quiet, or because a patient said they heard the nurses talking. Well, nurses have to talk. And it is a hospital. It is not a hotel, even though we would like to have hotel amenities like we did at cancer treatment centers. But there are times, and I was in the hospital during COVID, not with COVID, and it was loud at night.
Oh, of course.
And it happens, and that's why when you're in the hospital, you sleep during the day. Sometimes you get your sleep when you can get it. Mm-hmm. So I do think that we do a lot of things that are well-intentioned to try to solve problems. But I think if we were to step back and think of an experience as like going to the theater, something that is staged, and there's a cast, and there are props, and there are lights, and there are sound, and everything else. And the audience comes in and gets to experience it and have an emotional connection. But the work that goes in, all the rehearsal, all the staging, and everything else that goes on is choreographed. Well, that's what a patient journey does for us. We can understand from the time someone is healthy to the time they go through whatever illness they're going through, what their needs are along the way, and fragment it based on their age, their gender, or their religious preferences, whatever it is. And we can do all of that. Technology has helped us. I don't think we should be afraid of AI. We just need to be smart about how we use the AI so that the nurse can do the human touch and the AI makes it easy for them to do it. And that's what the journey mapping does. So I think that tackling nurse burnout is a huge opportunity, but I think the biggest opportunity that's going to come is it's going to give nurses the opportunity to find their voice again as innovators, find their voices again, to step up and say, hey, let's do this a little bit differently and be okay with it, because healthcare is such a big challenge. So I think that the idea of nurse burnout to me is like, okay, I get to clear my head. I get to think. I get to be the nurse I want to be, but also I get to raise my hand and say, hey, we can do this better. That's the byproduct of nurse burnout.
I think this is genius. I mean, I want you to come to you could do this in Scottsdale. By that, I was telling you, we're having an invitation-only think tank, but our June meeting in Miami, which is hosted by Jackson, very large, lots of nurses. But the idea of viewing healthcare at your hospital or your physician practice as a theater with acting, choreography, stage set, characters is really a fun way to do the journey mapping. I did that a lot with going to a hospital when I did Spirit of Women and women's health planning. We'd go and I'd say, if this hospital were a woman and a patient, what would she look like? What's her name? Does she work? How old is she? And the information we got through that creative envisioning was invaluable to really growing the business of women's health. What if we could do the same thing for making hospitals not only more nurse supportive and protective? That's a big word for Power Up Nursing. Our byline right now, Chris, is to protect and promote nurse well-being as the heart of healthcare. So to do that, and then to have the patients, we have a protagonist and an antagonist, but just to have fun with what needs to change so that everybody is cheering and satisfied at the end of the act.
Yeah, and if we were to take that metaphor a little bit further, the patient is, if the patient is the audience being served, to me, the nurse is the star and the physicians are the cameo appearances of superstars. And I don't mean that in a hierarchy way, but doctors only have a even more limited amount of time to spend with a patient. And the nurse is there to answer the questions that the patient forgot to ask or didn't know to ask at the time. They're there to be that sort of continuity of care person, the docent in the healthcare journey, if you will. And it's an amazing opportunity today, because we're not bound by limits of technology anymore. What we're bound by is our willingness to think differently, and our willingness to say that the journey isn't what we thought it was. And specifically, if we can step back and look at it from a patient's perspective, not from a P&L perspective. Because if you do the right things, the P&Ls will take care of themselves. I think you're muted a little bit, or I can't hear you.
Oh, I'm sorry. Say that again.
Say it again.
If you do the right
things, the P&L will take care of themselves. Right? I mean, it's not reckless or anything like that. I'm not saying, oh, just go do whatever. It has to have a plan, just like a well-staged play or a film has to have a plan. You got to follow scripts. And there's a way to do it, but it doesn't have to be dread-driven, right? It can be fun. You can be excited about going to work because I get to go to work and be a nurse at this hospital because I get to care for patients the way I always dreamed of. Wouldn't that be the great retention banner for that hospital?
This is my favorite thing I overheard. No, I didn't overhear it. It was said in my midst, not as a patient, but as I was there learning about the model with my women's health program. There was a doctor there from an oncologist, an advanced oncologist, surgeon, who said, why are you here? I asked the question. Why did you leave this huge practice, this well-known brand in Texas, as a very well-known, well-paid surgeon to come to CTCA? And he said, I'm going to be really honest with you, Tanya. When I first took the job, I took a pay cut. And why did I take a pay cut? And this is it. I was tired of being viewed as an ATM bank cash machine. And all I did was spit money at the cancer center. And I had no ability to be a human being. I had no ability to be a human being. I was an ATM machine. You know how that never has left my mind. And, he ended up doing really great things and is still at CTCA. So you're right. If you do the right things and you do it with heart and you do it with humanity, but we have that extra level now. And I love, you're just a man full of quotes today, Chris. Tech and AI, digital health tech and AI unbound us from limitations. Talk a little bit more about that.
Well, I think it starts with this, the idea of AI, and AI has been around a lot longer than people know. When ChatGPT came out, everybody was like amazed. And now it's like AI is a tool, like any other piece of technology. Like the technology we're using right now is an AI-driven tool, right? It's helping us have this conversation, right? And it's a tool, but healthcare is about human touch. Right? It's about being able to, as some of the doctors used to say, laying on hands or whatever, not saying that in a religious or spiritual, but literally part of a diagnosis to be able to touch part of the body, right? You can't simply go by technology. But even if it's not touching the body, it's also touching the heart. Why should anybody be asking what color someone's eyes are, or asking a patient to tell you, when you can sit down and say to a patient, you have beautiful fill in the blank, what color eyes, and that creates a sense of intimacy and trust right at that moment. right? And it's not hard to do. It doesn't cost any money, but knowing that in the point and process, when you're starting to get to know the patient, that you create a sense of closeness and intimacy by looking at someone's eyes and telling them that you like the color of their eyes. Or if you're going to explain radiation oncology for the first time, you use body language and you do this very gently on the back of your hands, and it's going to feel like a mild sunburn. Right? We went out and spent a year studying how cancer patients talk about their diseases and how they talk about their treatments. We created an entire lexicon, and we taught doctors and nurses how to use it, how to speak.
Beautiful.
Instead of teaching people who are emotionally distraught medical terminology, let's teach them what's going on with their health and their treatment in a way that is understood, that they can then say, go on. And there's a bunch of other really good patient education companies doing very similar types of things now. And it's a beautiful thing, as you say, because that's where the humanity lies, is I serve you. So there are only two jobs in healthcare. You know that, right?
No, what are they?
People serving patients and people serving those who serve patients. I learned that from a mentor at cancer treatment centers. If we just flatten it out and realize that all this whole thing is just about serving the needs of another person, whether it's at a patient bedside or serving the person who is at the patient bedside, that's what we ought to do. And it's no more complicated than that. And so I'm grateful for what I learned through the cancer treatment centers of experience. It was mind opening. And as you say, everybody remembers. I remember talking to someone who was on life support, a patient, and I went in and she's mid 40s, her parents were there, and I had met her parents once before, and they remembered me because I did something for them. They remembered a person who brought them a blanket, a sandwich, the acts of kindness. Right.
And the acts of wisdom, true. Absolutely. And they don't have to be huge things, I mean, that's gone. I mean, I remember when I was in marketing at McGee Women's Hospital, and marketing there was patient experience. That's what it was. And quite frankly, we had really bad HCAP scores, patient satisfaction scores, for like 4 months in one of the labor and delivery units, and then not great ones in another unit. So we hired, and I can't remember what the job was, but it was basically someone to come in and just watch, right? It was, somebody come and watch. And you know what we ended up teaching the group in the not great scores? How to touch the forearm of a woman in anxiety in labor. Right. And not rub it, just touch the forearm gently and lightly and look her in the face.
Yeah.
20% increase in 6 weeks in the HCAP score.
That's a great example, because there have been many time studies about waiting rooms. And what's interesting is that time, there's a point where time gets, it's too long to wait, obviously. But if you were to say that let's say it was a 20-minute wait, it's not unreasonable. It's long, but it's not unreasonable. 2 different patients could have very different experiences in that 20 minutes. And it's all based on the anticipation of what is about to come. So if you're a cancer patient and you're there for your checkup just to make sure, and you're feeling good and everything else, it's fine. If you're someone who's in active treatment and waiting to see if the disease is now under control or advancing, very different emotional states of mind. So one of the things that can happen is, how they have the for pain, the frowny face to the smiley face for pain, the 10 degrees of pain scale. You can do the same thing for anxiety in the waiting room. You can, whoever is at the desk or the waiting room, you put that. And if you see someone with a face that looks like this, anxious, right? Just see if there's someone in the back who could come out and say everything's going to be okay and offer reassurance. That 1 minute of time to do that changes the entire experience for that patient. That 1 minute.
And for everyone else in the waiting room.
And to see someone do that, right?
I think that's called the good old ripple effect.
That's right.
Humanity.
That's right. And so when we think about designing and orchestrating experiences, it's not about blowing everything up as far as process and everything else. It's about really understanding where that emotional inflection point is in the process, understanding what the best way to interact with the patient is, right? A lot of hospitals, they have, patient experiences like ambulatory or transportation, pastoral care, departments, right? No, an experience is a sum of all things. I don't walk away, telling a story about a brand because of one thing. I tell it because of a lot of things. And that's the other thing that I wanted to, make sure we understood, is that a brand is not what we say it is. It's what our customers say it is.
Right. Right. And it's what our nurses say it is at a hospital.
That's exactly right. It's what others say it is. Right. So you can own the brand and you can own the logo and have, money on that IP, but what that meaning behind that story of the brand is entirely in the hands of the employees and the patients, nurses.
And it's the action beyond the transaction. I remember once again being at McGee, the entire city of Pittsburgh. I don't know how it is. It's been years, decades since I lived there, but it used to be, oh my God, you have pain, go to McGee. You can't go anywhere else to have your baby, go to McGee. You have breast cancer, McGee will save you. It was a verb to McGee, right? And that is a love mark. That is a healthcare brand. I don't hear anybody say, go to HCA. I'm sorry, HCA hospitals. But it's become a corporate brand where there are St. Mary's or, there's an HCA hospital that has a love mark around it. And that's what we're forgetting about. We're looking at hospitals at, scores and revenues and very, very business-like models. But we also forget to look at corporations who are $1 trillion corporations, and they're all love marks. Nike doesn't sell shoes. Nike sells potential. Nike sells the body feeling good about itself. Just like a hospital isn't selling surgery, it's selling saving your life, right?
It's selling getting back to normal.
I like that better.
Yeah. Because patients want normalcy. They don't want to be sick. They don't want to, yes, you saved my life and I'll be forever grateful, but the experience was awful in the process.
Right. And that's what normalcy and getting back to normalcy is what nursing is all about. I am fine with this. Doctors are trained to diagnose and treat a problem or an acute situation. And nurses are educated to get people on the path to recovery or to an easier death. Either way, it's two different worlds. They work synergistically. They have to, right? But we forget that those are two very different roles. And instead, we ask now to save money, to increase efficiency, to increase staffing or decrease staffing. We ask nurses not to be path planners, right? We ask them to be acute problem solvers. And that's also a source of stress if that's not why you became a nurse.
And it's not to say that they can't be, or it can't be that. It's just how does it work? How does it work into the scope of the job, right? And in your question about interacting and honoring the experience of its nurses, I think that it's about giving them room to be who they want to be as nurses. And one of the things that I always used to love about, we had a patient advisory committee, and it was 100% patients. And we would go to those patients and ask them about everything from menus to carpet color to paint color to the processes that we did, anything we wanted to do. And the more we allow nurses the opportunity to get the feedback firsthand, instead of me facilitating it, getting some notes, handing you the notes and everything else, hearing it firsthand in a focus group or informal focus group, and being able to follow up with the questions that are important to you as a nurse is something that's very empowering. And so when I think about honoring, it doesn't have to be, yes, we want to give recognition, we want to celebrate, we want to do all of these things. Absolutely. But I think that action after those transactions is to have the nurses continuing on to learn from the patients they serve. Because that is where the innovation will come from. That is where the connectedness to the organization will flourish, because the people who walk through the door are only in there sometimes for a week, and you may never see them again.
Right.
So why not take the opportunity to learn from people who are former appendectomy patients, learn from people who are former, cancer patients or diabetic patients or
Or
whatever.
the family of hospice patients.
That's true. Whatever it is, whatever your area is, if you're, on the orthopedic floor and you're dedicated to orthopedic nursing, learn from the orthopedic patient, not just from the orthopedic doctor. And I think that's honoring the nurse, because the nurse then develops their voice about what ought to be better as we learn from the patients we serve.
Mm-hmm. Well, I am going to invite people to find you on LinkedIn and to communicate there. I like to keep our recordings brief, only because people are very busy. I let this one go well over 20 minutes because, Chris, you're a brilliant man. You're a brilliant person.
I'm chatty. Let's just say I talk a lot.
You talk a lot, but you talk based on experience. And I know we've only focused on the CTCA, but you've got lots of other brand building experience that have been based on putting how about something like this, planning for heart in the delivery of care in order to plan for better business. And that's, more heart, more profits. We just have to figure out how to structure that. And that's one of the things that Power Up Nursing is striving to do. If you're listening or watching and you want to learn more about Power Up Nursing, it's very simple. It's up top, www.powerupnursing.com. I hope to hear from you. But I'm going to get off screen and I'm going to ask Chris. I'm going to put him on the spot because he's obviously one of those TED Talk kind of guys. You know what, Chris? I'm going to ask you to talk to nurses. That is 85% of our listeners. I want you to talk to them, and I want you to tell them how to be a star. What are a few things they can do to have their voice heard on the stage of healthcare right now? In your experience, what has worked best? Just a moment so that they're going to remember that long after the podcast has ended. I'm jumping off. I will stop it when you say that's it. Thank you. And Chris, I so appreciate this half an hour with you.
Oh, well, thank you. And to everyone who's watching or listening, being a nurse makes you a star automatically, because it is a job that people depend on. Now, it's not even a job, it's a calling that people actually depend on. And if you're feeling worn out, if you're feeling overwhelmed, as natural human emotions, and I respect all of those, and I think working with an organization like Power Up Nursing will help find a better path. But being a star is first recognizing that you are that person, right? That person who is willing to comfort someone in need, that willing to, put someone else's needs ahead of your own. And it is a calling, as I said earlier. I come from a family that has at least 4 nurses in it. So I know a little bit from their perspective. I've worked in healthcare for nearly 3 decades, and it all comes back, whether you're looking at healthcare finance, whether you're looking at healthcare policy, whether you're looking at healthcare transactions, it all comes back to you. The doctors, yes, they are the ones who diagnosed and designed treatment plans and everything else. But without you and your role in the healthcare delivery world, we don't have care. So I guess the way I would say this right now, because it is off the cuff, is to say, first start that you know that you are the star. Work with an organization like Power Up Nursing to find your ground and find empowerment, so that it helps you build the ability, further strength to be innovative and have that sort of perseverance. But I just think the world of what you do. I think that the patients you serve think the world of what you do. You may not always hear it, but that's true. So the patient experience is all about understanding what a person needs, so that you and the doctors and everyone you work with in a clinic or hospital can give the patient what they need, which is healing physically, emotionally, sometimes mentally, so that they can pursue what they value most in life. And that's their normalcy, their path. So thank you, Tanya, for having me on today. And I wish Power of Nursing and all of the nurses who follow this program all the best.